This is Ben Wetmore with the Gateway Pundit. We're here with Dr. Mollie James, who's a trauma surgeon, and she would like to discuss some of the issues in the Thomas Crooks, Donald Trump shooting in Butler, Pennsylvania. Thanks for joining us, Mollie.
Yeah, thanks, Ben. Thanks for having me.
So you've been able to look at two photos, one, a drone footage of what the federal authorities are alleging is Thomas Crooks on the top of a building right near the Butler Farm airfield, and then another up close photo of of the deceased. Could you give us your impressions of those photos?
Yeah, thank you, Ben. So obviously the drone photo is high pixelated, it's from a distance, but the thing that's shocking on that is missing is the blood spatter pattern. So if somebody was shot, you would expect there to be blood behind the site of impact from the patient, and you would expect blood to be much wider than it looks like we see in this photo. We don't really see, this is like a hatched roof, if you will, with divots. And we don't see anything outside of the tray like in a Morton building. We don't see anything outside of the single lane that he is in. So that to me is unusual.
Now, if he died instantly, would that matter?
So with a gunshot wound, the blood continues to pump from the heart until the heart stops. So with a gunshot wound to the head, it's usually extremely messy. The exit wound is very large, and we see blood spatter, we see brain material, bone fragments, things like that should be present um, at the exit site.
And how far would that
So
go out? Like how much of a mess would that be?
that would be pretty wide ranging. And again, this was a long distance shot, so we would expect it to go quite a ways based on the fact that, high speed bullet, large trajectory pattern after hitting at the exit. So the entrance is always smaller, the exit is bigger. So I would expect to see that 5, 10, 15 feet. I don't know,
And there would be
noticeable.
pieces of skull and brain that would be there visible.
Yeah, so vertebrae, I mean, bone fragments should be visible in the photos, I would think.
How much blood would someone lose?
It depends exactly where the bullet hits. So looking at this photo, we can't tell the exact trajectory. We see a lot of soft tissue swelling in the face, it looks like, potentially the teeth or blood in the gums, things like that. The interesting thing is in this photo, the gentleman is laying on his side and has over his face. So blood, it follows gravity and runs down. It does not run uphill. So it's kind of interesting that he has blood on top of his face. You would think it would run down.
What?
So it makes you wonder if the body was rolled or moved in some way.
Huh.
I
Uh,
don't know when these photos were taken.
right, right. Um, and obviously he couldn't have been moved too much because you can see blood there on the ground. Assuming
Mhm,
that's his blood as well.
mhm.
Um, there seems to be something interesting about his neck as well. Do you notice that?
Yeah, so underneath, there's a trail of blood running from under the ear up to the nose, and underneath that, there's kind of a round cutout, if you will. I don't know if that's some kind of burn or something irregular. There's definitely kind of an arch that's cut out from that does not look like blood.
And you mentioned a burn. Like, have you seen anything like that before? Like, what could account for that?
Usually you see that at an entrance site. I'm not suggesting that's what this is, but when you think of the thing people forget is we think of a bullet as a sharp trajectory, but it's also spinning and has heat. So it's going to cause soft tissue damage in a rotational fashion. It's also going to cause burn through the tissue and splatter. So all of those things. So this is potentially around the exit point or something like that.
One issue that some folks on the internet have made an issue about is identification by his ear. And they're
Mhm.
trying to match different photos to his ear. Can you see at the bottom of his earlobe, there's kind of a cut. There's some people who think that that's a repaired a gauge, the holes that some people wear in their ears.
I'm looking at the photo now. It looks like it's a little inferior to be that. Usually that would have to be a surgical repair
Oh,
to repair the gauge from from that round insert into the ear. Usually that's just an open thing unless they have surgery where they go in and sew it together, in which case it would be more of a V shaped, bringing that soft tissue together and sewing it together. It would probably be a different shape.
okay. Um, one last thing that comes to mind. Federal authorities are saying that they identified him based on his DNA because there was no photo ID or other identification left. Is that normal?
That seems to be a fairly rapid turnaround time for a DNA test, but I'm not familiar with that aspect of the investigation.
Okay. Okay.
We generally called them John Doe until we had visible someone identify them visibly.
How long does a DNA test usually take?
I don't know.
Okay. Okay.
Yeah, I
Uh,
don't know.
thanks. Is there anything else that you'd like to add?
Just it's really hard to tell, but on the rooftop again, I've been in a number of gunshot wounds to the head. It's extremely messy. There's blood everywhere. There's bone matter, and a lot of times it doesn't make sense, until you understand the trajectory of that. And based on these photos, I don't think we have enough information to say what that trajectory may look like.
Sure. Sure. Well, there's definitely a lot more questions than answers right now, but I really appreciate you taking your time, and I know you have a busy practice and you're doing great things. So thank you very much for talking with us.
Yeah, keep up the good work to figure out what happened.
Thank you.